Yeah.
Welcome back. We're answering your allergy concerns now with specialist Dr. Adam Fox from the Evelina Children's Hospital. So welcome. Lovely to have you back. Let's get straight to the phones now, because loads to get through. Hi, Jaden.
Hiya.
Hi there. How can we help?
So basically, I've had hay fever since I was around 6 or 7. I'm 22 now, so it's always been like I've always known that I've had it. And most recently, I've been getting migraines on days that I've noticed the pollen count's quite high. And I was just wondering if either of those, like, is it just coincidental or are they actually related?
Can they cause migraines?
Well, it can certainly cause headaches. So if you imagine the lining of your nose is connected to the lining of your sinuses. And if you're all inflamed and angry in the lining of your nose because of the pollen allergy, there's a very good chance that your sinuses will be affected as well. And if you get angry, sore sinuses, that can give you a pretty nasty headache, which I think many people will think of as a migraine.
So with your, as you say, migraine, which funnily enough we were covering earlier on in the week, do you get the aura, the sparkly light migraine, or just a bad headache?
So it depends really. Usually I get the aura, but it's only ever in my right eye. So I notice it quite quickly when it becomes a migraine, because it is literally only ever in that one eye.
Right, and that is after the effects of the hay fever.
Yeah. So the antihistamines that I've been on from the doctors, they don't really touch the sides, to be honest. They don't change my symptoms that much. But when I notice that, like when the Met Office say that there's high pollen and stuff like that, I notice that my headaches get worse.
Okay, so if shop-bought medication's not working...
I think if you're finding that it's reliably worse when the pollen count is high, there's a good chance it's related. So the first thing to try, as you're doing over-the-counter non-sleepy antihistamines, but for a lot of people that doesn't quite do the job, and the next step is going to be a nasal spray. Nasal sprays are really effective. They do have a little bit of steroid in, but they're very safe. If you're an adult, you can buy them over the counter, but you can also get prescription ones as well. You can also get prescription nasal sprays that will also contain a little bit of antihistamine together with nasal steroids, so they're very helpful. The other thing to think about is what we call nasal irrigation. So just spraying some sort of salt water up your nose as a way of clearing all the gunk and the pollen that's up there. And if you go online, so the BSACI, that's the Society for Allergy People like me, their website's got very clear instructions about how you can do that.
All right, good luck with that.
Jaden.
We've got Stacey on the line now. Hi, Stacey.
Hi.
Hello. So you've always suffered with hay fever, but now your allergies are spreading in other areas, aren't they? What are you allergic to now?
They are, yes. It varies, to be honest. It's fruit and certain types of lettuce. I know it sounds crazy. But like apples, I used to eat apples till they come out my knees, basically. And darker leaves in lettuce, I get a suffocation feeling. Feels like someone's sitting on my chest. Also, my lips swell up and it feels like my tongue has been slit open.
Oh, wow.
So I just need some advice, really.
Okay.
Oh, that sounds awful.
So this is something that I see quite a lot of. It's what we call pollen food syndrome, also known as oral allergy syndrome. So it's where there's what we call a cross-reactivity between the pollen that you're allergic to. So typically somebody starts with having bad hay fever, and then they start noticing that they're getting reactions to things like apples and lettuce and carrots that previously they were absolutely fine with. And it's because there's little proteins inside those fruits and vegetables that look almost identical to the pollen that they're allergic to.
Oh.
So essentially what's happening when they're eating the food, their immune system thinks that they've taken a big mouthful of pollen. So they'll get a reaction to it.
Oh, wow.
Now, fortunately, those reactions are usually pretty mild. So what you're describing there is you're sort of very much sort of the, the extreme end of this.
Yeah.
Usually it's just a little bit of a tingle and that's it. Unfortunately, really, the main way of managing this is to avoid the things that are causing a problem, although often you'll find that if the food is cooked or if it's been processed in some way, so apples, for example, will be fine if it's in an apple pie or apple juice, because that little bit of processing and cooking breaks the protein down, so your immune system doesn't recognise.
So you can't desensitise yourself to that sort of thing?
So, no, not really. So you would think that if you've got for example, a tree pollen allergy, which is usually what drives this, that if you were desensitised, so had a treatment to make your tree pollen allergy better, that this would get better as well. But actually, it usually doesn't. No, it's not reliable as a way of treating. What's not worthwhile is to start avoiding all the foods that when you look up online are associated with this, just because they might cause a problem. You should still be eating everything you're fine with. It's just that if there's a food that is reproducibly causing a problem, try peeling it. So, for example, if it's an apple, try putting it in the microwave for 10-15 seconds. That often breaks it down, or just only eat it in the cooked or the processed form.
Okay, all right then,
I hope
Stacey,
that helps,
thank you.
We've got Rebecca, who says, about 2 weeks ago, I started developing hives all over my body. They were really large in size. I tried over-the-counter antihistamines, but they had no effect. I was diagnosed with urticaria and prescribed chlorphenamine 4 times a day, but it hasn't helped.
Okay. So I think everybody, quite understandably, tends to think that if they're coming out in hives, they must be allergic to something. But actually, allergy is only one cause of why you might come out in hives, or what we call urticaria. So that's sort of itchy rash. And there are a group of people who will start developing urticaria and keep going with it. And it's nothing to do with allergy at all. It's actually to do with them. And it's just a little fragility in the cells that contain the histamine that's naturally found in your body. And because of that fragility, your body keeps releasing it. And you end up being covered in hives, very itchy. It can be quite unsightly and very, very unpleasant. So typically what happens first is people will go to the chemist and say, I've got these itchy bumps, and they'll be given the short-acting sleepy antihistamines like chlorphenamine, and they're really not very good for this. So the first step is to go for the long-acting non-sleepy antihistamines. So you can get those over the counter.
What are they called?
So cetirizine or loratadine or fexofenadine would be the usual first-line ones. Often it's helpful to go for a bigger dose than it says on the side of the packet, because the dose on the side of the packet is really for hay fever, and often it's your whole body pumping out loads of histamine here. But obviously chat to your GP about what's a sensible, safe dose. But sometimes we will go for significantly bigger doses.
Really?
For some people, it's not quite enough, and there are other medicines that your doctor will need to prescribe that can help. And there's some newer medicines that have only been around for a few years that are really, really helpful in the most resistant cases.
So what would Rebecca ask for if she went to a doctor?
So in the first instance, I'd ask for a prescription for a higher dose of cetirizine or loratadine.
Yeah.
If that's not doing the job, I think I'd be asking for a referral on to either an allergist or a dermatologist to talk about these other medications.
I mean, this is similar to Natalie. She says, I suffer with hay fever. I'm currently using 180 milligrams of fexofenadine and a nasal spray. So that's what you were talking about earlier. I'm going camping for a week in August. The last time I went, it was hell. Is there anything stronger I can take?
So the nasal sprays are the best over-the-counter things that you can get. If you're finding that despite being on regular antihistamines and regular nasal sprays, you're doing the nasal irrigation that I mentioned earlier, and despite that you're still having problematic symptoms, then I think that's a good reason to ask to see an allergy doctor to talk about desensitization. So these are the treatments where either with injections or by using tablets under the tongue, we get whatever the person's allergic to and gradually expose them to it in increasingly high amounts as a way of retraining the immune system so it's less interested in the grass pollen or the tree pollen that are causing the symptoms. It's a very effective treatment.
Katie says, I'm 17 weeks pregnant, suffering badly with hay fever. What medication is safe for me to take?
So it's always tricky with pregnancy, because although most first-line treatments of the antihistamines are probably safe in pregnancy, understandably nobody's done a big study with pregnant mums in there because people wouldn't volunteer for that. So the first line is usually to go for the nasal sprays, the eye drops because we know that they're safe, obviously the nasal irrigation because it's just sort of salt water, that's very safe. If that's not doing the job and you do need antihistamines, we usually go for something like loratadine or cetirizine first line, because there's the most information about those that they're safe in pregnancy. But your pharmacist will probably not want to give you those over the counter if you're pregnant. They're going to say to you, we need a prescription from your GP to make sure that somebody's had that conversation to ensure that you understand that it's not really tried and tested in pregnancy.
All right, thank you
Thank
very
you.
much.
Pleasure.
Brilliant.
Yeah,
Very comprehensive.